Yes, Sartorius Gracilis semitendinosus. You're going to palpate this one just below the medial tibial condyle, and it's not. You're not going to be actually feeling. Well, it's tendinous. It's not muscular, but you're just going to feel a little bit of a give because it's tendon over bone, slightly posterior to where you'll feel the insertion is where the Anserine bursa is. That's a common injury or common condition. What's the word I'm trying to think? Pathology is the Anserine bursitis. So that's common to know with patients if they're coming in. They're saying they have this weird pain on the inside of their knee, and you're kind of struggling to figure out what it was. Think back to that. So going back to how we find medial tibial condyle, you can find that medial joint line. Come down to that medial tibial condyle, and remember, I think I've said this to a couple of groups. The medial and lateral tibial condyles are the whole aspect of the tibia where your distal femur articulates. We're just feeling that anterior aspect of it. So if that helps clarify, if you're trying to feel like a specific pokey, bony prominence, just remember that the condyles are the whole aspect of that tibia. We're just feeling the most anterior aspect of it. So feeling that anterior medial aspect of your tibial condyle and then moving just inferiorly to that kind of medial to where your tibial tuberosity is, you should feel firm tendinous insertions. And this will be your Anserine. So think about the goose foot kind of coming around, inserting on that anterior medial aspect. And I have a picture that we can throw up too. The picture helps think about it. It's not, like I said, it's not going to be really distinct. You're just going to feel tendons over bone. She's doing well, I can tell. Huh? No. You just know where it is. You know what it makes up. Or what makes it up. Okay, so then I'm going to have you lie on your stomach, please. Put this underneath your stomach for head.
Beautiful
here.
sneakers.
They're so clean.
They are.
Yeah. Okay. I think I can try and reach across. So relax. The next structures we're gonna find are posterior knee tendons. You're gonna have the knee in slight flexion. You want them really, really relaxed. You're gonna start at that popliteal fossa. Remember, this can be sensitive for some people. There's various vessels and whatnot that run in that popliteal fossa. But if you're starting that popliteal fossa, pressing slightly deep and moving medially, the first tendon rope-like structure that you should hit is the semitendinosus. We'll get to all of them, but semitendinosus, starting in the middle of the popliteal fossa and moving medially, so towards her midline. Semitendinosus. To confirm I'm on that, I'm going to have her internally rotate the tibia. Can you point your toes in? There you go. And then just have her hold. That's enough. You don't have to give any extra resistance than her just holding her leg up. And I guess you can't see it on the camera, but when you guys do this on your patients, you should be able to see it pop up. Very easy. Okay. Staying in that popliteal fossa, moving laterally, that first thick ropey tendon that you feel should be your biceps femoris. So we're gonna do same but opposite. We're gonna have her externally rotate her toes. Oh, there we go. And then hold, and you'll feel and see that tendon pop up. Okay, relax again. Going back to the popliteal fossa, moving medially, and then you finding that semitendinosus. Can you turn and hold? Good. Going one finger, relax please. Going one finger width more medially, so towards the opposite leg. The next tendon that you should feel should be gracilis. And to confirm that, I'm going to have her hold her leg, but adduct. Can you push her knee into my hand? And you should feel on the adduction the difference between gracilis and relax. There you go. The difference between gracilis and semitendinosus. Sorry, I have to keep them all straight. Here, can you push your... Easy to find. Okay, push your knee into my hand. There we go. Okay, so we have semitendinosus and gracilis both on the medial side. In between the tendons that you'll feel for semitendinosus and gracilis, if you move slightly superior, and I mean maybe half a finger width to a finger width, and then deep between semitendinosus and gracilis, you should start feeling a flat, broad tendon, and that's going to be your semimembranosus. So it's between tendinosus and gracilis will be membranosus. And to confirm, that's just going to be straight knee flexion. So just keeping her tibia in neutral IR, ER. You can really let go, have her hold. You'll feel that tighten up deep under your finger. Does that make sense?
Yes.
So starting in the popliteal fossa, first one you hit medially will be semitendinosus. Moving medially from there will be gracilis. Between those two, but deep, will be semimembranosus. And then back to the popliteal fossa, moving laterally will be your biceps femoris. Good?
Yes.
Let's practice those. Plus your